this is Dr. Sita Rajan, consultant OBG at Manipal Hospital, Vartur. And I'm here to tell you about the effects of cancer on fertility. Very often we get patients coming to ask us which is the appropriate age to conceive after cancer. Now this entirely depends on number one, what cancer you have had treated so far. Second, are you in remission if it is a blood cancer or any of the other cancers where your chemotherapy or your oncologist wants to wait for some time. Once they clear you saying that no further follow-ups are required, you are completely out of danger, then it would make sense to try to conceive. It also depends on what is your health status when you decide to conceive. If post-treatment of cancer has compromised the kidney function, liver function, blood clotting factors, blood counts, all of that needs to be corrected, needs to be optimum before you start trying for pregnancy. So there is no absolutely appropriate time. It depends on how healthy you are and how much your oncosurgeon or chemotherapist has cleared you to start trying for pregnancy. The next question very often asked is patients who are a little older, who have finished with their cancer therapy, which is the birth control method which is the optimum for them. Now this again depends on whether you've had any genital cancers, that is your uterus, ovary, tube still intact because you've had some other cancer, and then we decide what method to use. The birth control pill which affects liver functions, which is obviously going to be something which any doctor would veto. So you could either continue to use just the barrier as we call it or the condom, or get an IUCD or intrauterine device inserted if the gynec organs are intact. The other question which very commonly comes up is, if I am diagnosed with cancer while pregnant, what do I do? Now the signs of the cancer, if at all, should probably have been there even before you conceived. And here it is very important when you first see a doctor in pregnancy to share with them what is your relevant family history. Do you have a significant family history of breast cancer or any other cancers where the doctor then decides whether there is a possibility of it coming up in you because of a hereditary factor, either now in this pregnancy or even later. That helps us a lot. Apart from that, any changes in your symptoms which could be sinister. For example, do you feel a breast lump in pregnancy itself? Do you feel anything else in the form of abnormal discharge from the cervix, which could be cervical cancer? These abnormalities or variants need to be shared with the doctor. Then of course we would advise you whether it is okay to continue waiting till the pregnancy is over so that we don't compromise the fetus, or whether the cancer and the staging of the cancer takes precedence and whether we have to get on with the treatment in spite of you being pregnant. For example, if it is a cancer cervix, if we have to get on with it in the form of surgery, we would do it. If it is ovary, it could wait. If it is breast and it is looking like it is spreading fast or advanced, we would take the precautions of trying to avoid any radiotherapy or chemotherapy that may harm the child inside, but we would still advise surgery. So in this way, if number one, you are trying to conceive, if you have any significant history, share it with the doctor. Any significant findings you have noticed, share it with the doctor. And after that, if you're already recovering from cancer, discuss with your oncologist and your oncosurgeon whether it is ideal to start trying, or rather which time it would be ideal. Then the obstetrician takes over and takes you through your journey of pregnancy. I hope this is illuminating enough for you to make an informed decision about these points. Thank you.